tips. This is our weekly check-in. We go over different topics in plastic surgery and I get to answer your questions. So today we're going to be talking about a different topic, blepharoplasty. What is blepharoplasty, that fancy word? Eyelid surgery. Yes, I do eyelid surgery. Eyelid surgery is a very, very powerful procedure that can change someone's appearance drastically. Aging around the eyes is very dramatic because we have excess skin, excess muscle, excess fat that accumulates and gives that tired look around the eyes. And by doing this surgery, it's a surgery that, even though it's in the eyes, is delicate. The recovery is not as tough as some people think, and actually the results are very, very dramatic in the sense that it brightens your face a lot, and also there's a functional aspect to it that I'll discuss, okay? So blepharoplasty is a fancy term of eyelid surgery, and eyelid surgery can involve the upper eyelids and or the lower eyelids. So this is my fancy diagram here of an eye. This is like the right eye, so nose would be here. And let's start with the upper eyelid. The upper eyelid is definitely the most common of the two, okay? In the upper eyelid, we do see more aging changes commonly because of the excess skin in the upper eyelid. It is one of the most common surgeries in men, actually. And age-wise, it is a wide range. I've done blepharoplasties in people in the 30s because genetically they're more predisposed to have excess skin and sagginess in the upper eyelids. And it goes to, 70-year-olds that have that excess skin. In people that are more older, like 70 or 60s or 70s, this can interfere even with their visual field, that excess skin lagging over, and they have to literally like pull the eyebrow up to have a complete visual field. So it can have a functional aspect in people that have that problem, okay? And that I mentioned, this is as a relief for some people that do it. It is actually extremely important to go to a qualified plastic surgeon, board certified plastic surgeon who specializes in facial procedures to evaluate the eyelids, because the eyebrows are very, very important when we're talking about eyelid surgery. The descent of the eyebrows may contribute to the worsening of the excess skin in the upper eyelid, and if you do not address the brow and just address the eyelid, you're not going to be satisfied with your results. So it is important that you have a complete evaluation of your face, and not only you go to a place that says, I just want my eyelids done and get it done without a full facial evaluation, because you may be obscuring other contributing factors to that sagginess of the skin, okay? So you're a good candidate. People that that have dry eyes should be seen by an ophthalmologist before the surgery, because eyelid surgery may worsen your dry eyes, okay? So it's important to get a good evaluation, make sure that you are in the right drops and in the right treatment after surgery so you don't get corneal abrasions or problems in your cornea and vision problems afterwards, okay? So that's mainly one of the few contraindications or just like red flags that you need to check. The other thing that's important is if you had LASIK surgery, wait at least 6 months from your LASIK surgery to have eyelid surgery. Same thing, we want that cornea and that eye to recover completely before doing the eyelid surgery. Even though we're not doing the surgery in the eyelid is the protective structure of the eye. So when we are removing that excess skin for the first few days to week after the surgery, you may have inability to close the eyelid completely, which may worsen the dry eye or problems like if you have LASIK surgery, okay? So where is the surgery, or what do we do? It's basically an incision hidden in the crease of the eyelid. So it's a surgery that hides very well and it heals very well. The skin in the eyelid is very, very thin, and that incision heals so nicely that in a few months to a year, it is almost unrecognizable, unseeable, okay? So it heals very, very, very nicely. Basically, we remove that excess skin. It is important to leave a certain amount of skin in between the eyelid lash border and that incision or crease, and the same your uppercut and the eyebrow to protect the function of the eyelid, which is the full closure to protect your eye. So that skin is removed. I do remove a strip of muscle as well. The muscle contributes to the bulkiness of the upper eyelid. So I do remove, not every surgeon does this, and not every person is a candidate. If you're very thin, I may not remove your muscle, but majority of patients that have this sagginess, the muscle has already been stretched and saggy too. So I remove a strip of muscle. It does not interfere with any function of the eyelid. The muscle goes around the eyelid completely. So by removing just a strip, the function of open and closure does not get affected at all. And the other important component is removal of the fat compartments, okay? When we get older, the fascia or the soft tissue supporting the eye structures gets soft, gets stretched, like everything. And those fat structures that in the upper eyelid we have two, the nasal and the medial one, get more bulgy and more noticeable in the exterior, okay? So I do remove those two compartments. You want to remove enough that it's not bulging, but leave enough to do not create a sunken eye look like your skeleton. You do want some fat in that area, because if not, it looks very sunken, okay? So removing that excess skin, removing that excess muscle, removing those fat compartments, and then suturing. I do use two types of sutures depending on one, patient preference, patient's anxiety level to removing sutures in your eyelid, but I do prefer non-absorbable sutures. That means that I'll need to remove them 5 days to 7 days after surgery, because the scarring is better, okay? When I remove that suture, there is no inflammatory reaction trying to dissolve a stitch, okay? So the scarring is a lot better, and like I mentioned, very noticeable 6 months to a year after surgery, okay? So that's pretty much the upper. The lower eyelid, it's a little bit more involved in the sense that there's 3 fat compartments, and there's the soft tissue of the cheek that we need to reposition to improve the appearance of that lower lid and lower lid to cheek junction. Smoothen that. If you go to a magazine and you see like young models and you see like, why do their faces look young? One of the key features is there is barely any transition or difference in between the eyelid and the cheek. There's a smooth transition. With aging, we have descent of all the soft tissues, and that difference between the eyelid and the cheek gets more pronounced or more noticeable. So one of the things important in lower eyelid surgery is repositioning that soft tissue fat, bringing it up to smoothen that transition, okay? Those 3 fat compartments is sometimes what you see, like those bag eyes under it, that's removed. Also removing that excess skin, that contribute to the baggy eyes. The incision in the lower eyelid is just below the lash line. So it is an incision on the exterior. Most of the time it can be done also from the inside of the eye or the conjunctiva. But that does not remove excess skin, that just removes excess fat. For people that don't have a lot of wrinkly or excess skin, it's more the bulgy or excess fat. That is a possibility. Usually in the younger patients, 30s and 40s, that have genetically like baggy eyes, that is an option. But if you are a little bit more older and have that excess skin, then it's in the just below the lash line. Very, very good healing involved on that area. So even though it's in the exterior, it is an incision that heals very, very well, okay? Both of these surgeries, if you're doing it combined, I prefer to do it under general anesthesia, especially the lower is more uncomfortable because of the repositioning of the soft tissue. If you are doing only the upper eyelid, it may be done under local and sedation, not necessarily under general anesthesia. A lot of my patients combine eyelid surgery with other procedures. For example, they come for a mommy makeover and then they get their eyelids done, okay? It is an option. So things to consider if you're getting another procedure. I don't combine it with all procedures, depends on basically time of procedure. For example, a rhinoplasty takes me a long time, so I'm not gonna be adding a lot of things. But with a mommy makeover, that's like a 2-3 hour procedure. We add the eyelids at just an extra hour, and it's still under the 4 to 5 hours that I don't like to overpass, okay? And that is to decrease risk of anesthesia complications and intra-op complications, okay? So that is basically the surgery itself. And then the recovery, like I mentioned, even if that it's in the eyes and it's a sensitive area, it is not a very painful surgery. We're talking about skin, muscle, and fat surgery, and it doesn't go deep to structures of the eye. So it's not very painful, very well tolerated, a lot of bruising. So it is something to consider if you work with people. The bruising may last for up to 2 weeks. So at 2 weeks, you can hide it with makeup, and that's fine. But for the first 2 weeks, I ask you not to put makeup on the eyes. So if you are in a camera or working with people at a front desk, for example, then you'll have to time it that you have at least 2 weeks off so you can be presentable. If you're working from home, then definitely some people start working like 2 to 3 days after the surgery because they're not in a lot of pain, okay? So that's basically it. What are the common surgeries that gets combined with? Definitely facelift surgery. So if you're having your face, it is a very good adjunct to have a complete facial rejuvenation, to have your eyelid surgery. Mommy makeovers, like I mentioned, if you have your breast procedure, we can do that. With lipo, the problem is, especially with BBLs, you're going to be laying on your stomach and you get very swollen in your face. So I don't like to combine face procedures with like lipo BBLs because of the swelling involved, okay? But mommy makeover, breast, facelifts, all of those are very common procedures. Or if you want just the eyelids done, of course, that's also an alternative, okay? I'll get some questions now if you guys have.
Okay, here, I'm guessing is transconjunctival?
Yes, correct. So transconjunctival is the eyelid.
Sorry.
Yeah, it's okay. It's the lower eyelid that I mentioned that can be done through the conjunctiva. So the incision is hidden on the inside of the eye. That is for the lower eyelid. In the upper eyelid, we have to remove excess skin. There's always a component of excess skin in the upper eyelid, but like I mentioned, it's in the crease, so the incision it's barely noticeable afterwards. But the lower eyelid transconjunctival surgery is very good for people that do not have a lot of excess skin, because the transconjunctival approach does not remove excess skin, just excess fat, okay? So if you have like baggy eyes, bulgy, without a lot of excess skin, you're a good candidate for it.
I had it done 5 weeks ago with Dr. Vidal, and I'm over the moon happy.
Ah, that's awesome. Very, very glad to hear, and glad that you're having a good recovery. Great.
Me gustaría hacer una cita con usted, doctora Natalia. ¿Cómo hace?
Seguro que sí, bien facilito. La manera más fácil es yendo al website. Si vas a Google, puedes escribir plastic surgery. Si vas a mi link en Instagram o en TikTok, en el bio, le das ese link y te va a comunicar con nuestro website, que te va a poner el link de un virtual consultation o una consulta virtual. Le das ahí, y a pesar de que tú me quieras ver en persona o que quieras hablar conmigo, claro, pero el primer paso siempre es ese, ¿ok? Eso lo que te va a pedir es tu información, unas fotos, yo evalúo tu caso y ahí una coordinadora se comunica contigo y ahí pues te explica todas las opciones de consulta en persona, consulta virtual o pues reservar la cirugía.
Yeah, the patient again,
Okay.
she said, no pain at all in my case, great experience, and would have done it sooner.
That's awesome. Yeah, and that's very, very commonly I hear my patients saying like I had barely any pain at all. I mean, you look beat up because you get swollen and bruised, but you don't feel any pain. That's very, very common. I'm very glad.
What do you send your BBL patients home in?
Okay.
I think has to be the faja if they're going home or no.
I'm thinking a couple of things in terms of compression garment. You're going to have a stage 1 faja that I'm going to give to you the day of surgery, but you won't wear it for the first 24 hours. I'm going to give foams to you also the day of pre-op, but same thing. You're going to take them home. You're not going to wear them for the first 24 hours. So basically 24 hours after surgery, you get your first massage. You make you may shower after the surgery, and then you start wearing the foams and faja. In terms of DVT prophylaxis or blood clot prophylaxis, you're gonna be sent home with compression socks, and I'm gonna ask you to walk every hour. And medication-wise, you're gonna be sent home on an antibiotic, and then 2 medications just in case you need them, one for pain and one for nausea. That's awesome, you guys. Thank you so much for joining. The reason I decided to do a blepharoplasty Tuesday tips today is because there is a very good before and after coming today or tomorrow.
Yeah.
Soon about blepharoplasty. So
I feel pressured.
So hint. So that's coming out. So I wanted to take the opportunity to discuss this topic that it's very, very common and I hadn't talked about it before. So I hope that this is helpful to understand a little bit more about the surgery. And if you have any questions, of course, let me know. And I'll see you guys next week on Tuesday Tips. Take care.
We have 2 more minutes for one last question that just came in, but it's a very good one. Okay. Can a BBL and a tummy tuck be done together, or should they be separate?
I like to separate those 2 procedures, okay? The reason for that is 2 main things. One is your safety, okay? Due to, I am operating in an office-based facility in Florida, so I have a limit of fat removal, and that's because you're going home, you're not staying in a hospital facility that I'm gonna be giving you IV fluids and stuff. So there's a limit of 4 liters I can remove with a BBL, and with a tummy tuck, only 1 liter. So the combination of those 2, it's not gonna be possible. And the other one is recovery reasons, okay? I want you to have the best result of each of those procedures. For that, I'm gonna tighten your belly so much with the tummy tuck that I'm gonna ask you to be hunched over and sleeping in your back. And for a BBL, I don't want you to kill the fat, so I'm gonna ask you to sleep in your belly and do not sit. So the combination of the 2, that to maximize each result, I don't think it's possible. So it's better to stage it. In terms of which procedure first, I do recommend doing the tummy tuck first, and then 3 to 6 months after the tummy tuck, then you can have your BBL. Okay? Take care. See you guys next Tuesday.
Oh.